This is Scott Becker with the Becker Private Equity and Business Podcast. We try and bring you each day brilliant business leaders, private equity leaders, people that have a perspective and a point of view. We're thrilled today to visit with Bart Walker. Bart's a partner and leads up part of the healthcare practice at McGuireWoods. He's got this fascinating background. And aside from being the father of, I think, 8 or 9 children today from one wife where they're happily married, one family, he's also a Notre Dame, insane Notre Dame fan, and an incredibly one of the highest integrity, smartest people I've ever had a chance to work with and visit with. So, Bart and I are going to talk about some of the trends he's watching across healthcare private equity currently, moving from PE funds to independent sponsors and experienced investors versus not, and a lot more. Bart, can you take a moment? We used to joke that your family has its own HMO. I know that's not true, but you do have your own school, so that is true. Uh, but tell us a little bit about Bart Walker and your background, and then we'll jump into the gist of discussing private equity and healthcare and what you're seeing today.
Sure. Thanks, Scott. And sometimes I wish we had our own HMO because I think it would probably be cheaper than our health insurance. So we do have our own school. We homeschool our children for the most part. We take kind of a hybrid approach, but I've been with McGuireWoods for my entire career, which is over 20 years now, and learned most of what I know from Scott and putting a lot of those practices into play in my career and with the younger generation that we're mentoring and bringing up behind us as well. I'm heavily involved in the firm's healthcare and life sciences industry team, which I co-chair, as well as being involved in lateral partner recruiting and always looking for good new partners to join the firm. Thrilled to be on and happy to talk about some of the things you mentioned.
Take a moment here, and I know it's a sidetrack for a second, but we had talked about insurance cost. It seems like this is the first year in a while where I feel like they've jumped more than I expected. And that's not a knock on anything, just an observation. I mean, insurance costs have become incredible in this country. I guess that's healthcare costs because it's a directional for that. Is there any hope in sight on that, or is that's part of the discussion we'll have today? But are insurance costs just going to continue to escalate at a level I feel like we've not seen in a while?
Yeah, I mean, you look at an aging population at a very macro level, and claims are going to increase. People's life expectancy is generally increasing. Quality of life, not necessarily so as you reach the older years of lifespan. But I think that's part of it, is there's more claims. We continually have a less healthy population. We've got diseases of overabundance. We've got obesity, diabetes, heart disease, cardiovascular disease, all forms of cancer. And so you see that as a mix of on the cost side or the loss ratio side of the health insurance business, that's not getting any better. At the same time, you see healthcare insurance companies consolidating as well. That really hasn't bent the cost curve either. I don't really have a lot of optimism. Unfortunately, I'm not sure what the right answer is. At the same time, most of my clients are healthcare providers or folks who invest or lend to healthcare services companies, and they're not seeing their margins improve at all either. They're under constant downward pressure, so that business is not getting any more profitable. And I think, as you pointed out a couple of times, at least today and some of our other correspondence, there's a big healthcare provider shortage as well. So it's a sector that's beset on all sides with a lot of challenges, but I think there's a lot of opportunities. I'm not sure it's in the healthcare insurance side, and I think a lot of the insurers have rightly gotten into the provider business and tried to integrate some of those sectors. Maybe that helps, maybe it doesn't. But when you look at some of the macro trends, I just have a hard time seeing how that's going to really change anything in a meaningful way.
Thank you very much. And take a moment on, you would sort of walk me through 4 or 5 trends that you're watching in healthcare this morning. If you don't mind, take us through those 4 or 5 trends that you're watching, maybe one by one.
Sure. Yeah. So the first concept is generally tourists in the healthcare services area, meaning folks who are just looking at that from a business perspective and looking to invest in or lend money to the healthcare services sector. Generally, tourists are not doing well. If you do one or two deals in the healthcare services area, it's a pretty steep learning curve. And unless you got the right advisors, and I'm not talking about just lawyers, but also accountants, financial, reimbursement, and so forth. Unless you've really got the right team in place and can get up that learning curve very quickly, there's a lot of shoals you can hit on that voyage. You really need a serious depth of knowledge. And one of the things we're seeing too, there was a whole phase of healthcare roll-ups in the industry, which were generally pretty profitable early on. But I think we're getting to the point where just a simple consolidation strategy really doesn't work anymore. And all the funds that I'm talking to and the healthcare providers that remain independent, they're really focused not just on financial engineering, but really getting down into nuts and bolts of operating a sound business beyond that. And it's where can you generate synergies? How do you take care of people and really manage talent? How can you create a winning culture? It's far beyond just simple. Now, I want to downplay, financial engineering because there is a lot you can squeeze out of it that way. But the game is changing, and those who are kind of just making their first forays into the space, unless you're really committed to it, I think it's really easy to go off the path.
I think
Um,
that's well stated. We always talked about funds that were highly committed to healthcare, funds that were not, and obviously the biggest funds in the world today all have big healthcare components to them, just because it's a big part of the world and economy. But there are still mid-sized funds that dabble in it and then find themselves periodically surprised. I think that's partly your point.
That's exactly right. Yeah, there are too many ways that people can cheat. There's too many ways people can hide things, and not everybody's a good person in this world. So you have to really know how to turn over all the rocks. And if it's your first foray, it can be a daunting challenge. So
Fascinating. Take a moment and tell us what else you're watching closely besides the tourist spot and stuff like that,
sure.
the people that tourist into healthcare versus live in healthcare.
Yeah, there's been a lot of talk about technology and AI, and I think that's all well and good, but healthcare services in particular remains a people-driven business, and I think people tend to lose focus on that. And if you've got great culture, great people, I don't think that'll ever be obsolete. I don't think you can ever replace that with AI. Sure, you can make incremental improvements and in some places transformational improvements, but you still are going to have people to run it. So I don't see that going away anytime soon. There are staffing challenges for the right kind of people. There are lots of workers out there. I think what we're seeing in a lot of these subsectors where you need real deep sub knowledge, like if you're running a dental services organization, just a general healthcare generalist executive won't really cut it. You really need somebody with deep expertise in that specific sector and the challenges that are specific to it. Same thing with a lot of the physician specialties too. We're seeing increasing specialization, and you really need people to manage and run those and lead those efforts, or you're going to get into big trouble. And you can't replace that with technology or AI. There still has to be somebody setting the course and thinking about strategy and looking at competitive threats. It's a tough business. There's a lot of opportunities, but there's still there are a lot of challenges too.
Right, but at the end of the day, we still need people to take care of people, so it ends up still being a relatively labor-intensive business, particularly as people age as well. I mean, it strikes me, and I think your point is well taken on that, that it's labor and tech. It's not one or the other. So it's a constant need to make sure
Right.
workforce is strong enough and large enough to take care of people and staff all these things and make them go. And more the growth of some of the private equity funded companies and the bolt-ons and platforms, the limiting step is being able to staff and have the number of physicians that need to grow and make things go and so
Right.
forth. So I think that's exactly right on.
Technology won't scale you by itself. You can add technology and you can enable with tech services. And maybe what we'll see is a stratification where you've got certain commodity type healthcare services with telemedicine. Maybe that takes care of a lot of the kind of day-to-day office visits, but for the higher acuity stuff and the things that are really life-changing type events, I mean, those are always going to be human to human type interactions with some real difficult choices and judgment calls. And maybe that's assisted by AI, maybe that's assisted by technology, but at the end of the day, somebody's got to make a call. And I don't think anybody, at least in our generation, is comfortable with a non-human making that final determination. So it's going to be an interesting evolution over the next 10 years to see how it plays out. But I don't think it's an existential threat as we sit here today to healthcare services generally.
Right. It's both the making the call and also the human connection with patients and constituents that need that human connection. You and I know that the simple answer is trying to get through to some phone system the other day. It happened to be the IRS. And if you actually want to talk to a human, you might be on the phone for hours and hours, and you can't even click the buttons quick enough to get to a real person. And that is just incredibly frustrating for any sort of person, and particularly in healthcare or any area, if you don't actually have some people to help navigate too. And it's always been a shortage in healthcare as care navigation, and it's going to get worse if there's not people as part of that process too.
Yeah, and I
Bart,
think there's something to be said there about consumerism and the retail aspects of healthcare services, especially for cosmetics and elective procedures and more health optimization plays within the healthcare services sector. I think as people become more conspicuous consumers, that human element is really, really important. Brand becomes more important, reputation becomes more important, and the ultimate end user or the patient, what their experience is when they walk in the door. I mean, that's the goal. All of this is driven towards that. And if you can't optimize that experience in a way that's both profitable and pleasing from a customer service standpoint, you're kind of dead. Everything else can go right in the back office and on the balance sheet and income statement, but if you get to a spot where your patients aren't happy or they walk across the street because somebody's offering a better product, you're not going to be able to compete.
Thank you very, very much. Could not agree more. So we've talked about the need for people. We've also talked about sort of the investors that tore in and out of healthcare. Take a moment on the next big thing or next thought that you're looking at.
Sure. The third concept I'm looking at is the emergence of independent sponsors. And here at the firm, one of our partners, well, several of our partners, really led by John Finger and Jeff Cockrell, Tom Zahn, had the foresight to create this network of independent sponsors. And for those that aren't, in the PE world, what that means is it's essentially someone, an entrepreneur, typically someone with experience in a particular sector, has found a company that they like and they want to invest in and run, but they don't have committed capital behind them in the form of a committed private equity fund in the traditional sense. So what they typically do is they go out to the equity and debt markets and raise funds on a deal by deal basis. And so once they've got that letter of intent or an indication of interest with an attractive company, they go out, raise the funds, and then do the deal, and then continue to run it, grow it, make it more profitable, and then ultimately exit either to a bigger strategic consolidator or to another private equity fund or go public, whatever the exit strategy is. We've seen a tremendous growth in that, and we've got a independent sponsor conference that attracts 1,400 people now. I think the first year they did it, it was a few hundred, and now it's just this gargantuan thing that's taken on a life of its own. I take that as an indicator that there's this vast untapped long tail of equity investment in healthcare services in particular. It applies to other areas as well, but we're seeing it more and more in healthcare services, where you have a very granular data set of deal opportunities that aren't being filtered through the traditional channels of investment bankers or direct to PE fund proprietary deals. And it's capturing that long tail. There's a lot of opportunities there. I think the downside to think about is if you're doing a one-off independent sponsor deal, you lack the diversification you would have if you were just investing as a general partner in a private equity fund. So you really have to look at that specific deal and then across your other portfolios of independent sponsor deals, how do you diversify against that? But it's an interesting business model, and it's definitely a new development that we're keeping our eye on. And we've been doing more and more of those kind of deals. They can be a little nerve-wracking. With private equity fund clients, you can always say, if we have a broken deal, we can catch up on the next one, or we can, work with you on the legal side and the other advisors. Here, it's kind of like you've got one shot at it, and you need to take a very disciplined approach, because some of the deals that independent sponsors find are not really viable. Others are fantastic. So you have to have that judgment we talked about earlier, where if you're looking at a deal or an investment opportunity, you really have to have the judgment and experience to be able to determine very quickly the winners from the losers. Fortunately, that's not my job. We can kind of tell from the legal side if things look right or wrong, and we can definitely be a sounding board and generally have a pretty finely tuned barometer around that. But on the business side, that's a much trickier proposition, especially if it's a company in growth mode, and trying to predict where where the growth will project out over the next 3 years or whatever the investment horizon is.
Thank you. And that independent sponsor world is a fascinating world. It's really comprised of a whole mix of people. It's people on the way up that are just trying to get into the private equity world in a more serious way, that were consultants and operators and so forth. And it's also experienced people from private equity funds that have at some point left the private equity fund world and we're looking for just more freedom, more autonomy, and they're doing one-off deals. And we've worked with both sides of that equation, and some of them extremely experienced investors and operators that just happen to have wanted to take a step back. One of them to talk about particularly made an absolute fortune in the private equity world, and then wanted to do smaller deals. Really, that he was running his own shop without committed capital and didn't have to be responsible to investors in the same way. And I think just fascinating to watch the difference in sort of how that independent sponsor world has emerged. And it seems like in a lot of these worlds, that world goes up and down as well. It becomes very busy. Then you see less of it. Then you see more of it. I mean, we're seeing now again the huge funds putting money to work again. Not seen in a while, but it is fascinating to watch this independent sponsor world evolve as well. So that was the third key trend we're talking about: is independent sponsors. We've talked about workforce. We've also talked about sort of the changing dynamics in tourist funds and funds that are long-term versus not long-term. Bart, give us another trend that you're watching.
Sure. The next one is sort of a negative trend in the sense that it's something we're not seeing. We've really not seen the growth of the healthcare system in the United States being exported to other countries. It's really a unique system we have. It's largely still private payer, although Medicare is a huge beast these days, as well as the state Medicaid programs, which is a federal state partnership. But in terms of expanding that to places like the UK or Asian markets or South America or Canada, like they all have very, very different payment systems. They have very different care delivery models. And I think what makes America unique, and sometimes international investors, whether they're sovereign wealth funds or international PE funds, what they don't recognize is that in the United States, we have a very interesting, different reimbursement environment. You've got the blend of public and private commercial payers. You have got a self-pay element to it. But then we also have an incredibly high demand for accessibility. Americans want healthcare immediately. They want to be able to get in to see their doctor when they want to. And they also have a very low tolerance for poor quality. So triangulating for those three things, it's a difficult place again to be a tourist in, and it's also something that we've not really seen extrapolate out to other markets beyond the U.S. I think we have a great healthcare system. I don't know this the right fit for everywhere, and it's a complicated question to ask because there are cultural factors, there are historical, socioeconomic, geographical issues that make the United States special and unique. And applying that to healthcare, it doesn't really translate to other environments. So we really haven't seen much international reach in a real sense, at least in the investment world.
No, fascinating. And there are so many differences and systems throughout the world. I mean, here in the United States, we've got 50 different payment systems by 50 different states. Then we've got hundreds of different payers, including 4 huge ones. Then we've got the government payer, the Medicare, but then we've got Medicaid, then we've got VA. And so you literally have dozens to hundreds of different payment systems in one country, and it does make it sort of a cluster. But you do hear in other countries similar challenges of, doctors wanting to get paid, not having enough doctors, not having enough access, patients wanting help, and the same issues they have with insurance companies that we have here. So there's a lot of differences and a lot of similarities as well. And I think it's fascinating to watch. Bart, you also are involved in running two of the firm's healthcare conferences, the Healthcare Private Equity event in May, the Healthcare Financing Growth event in September, I think. Can you take one moment on those two events, the healthcare business conferences that the firm
Sure.
drives?
Yeah, would love to. So we have our annual healthcare private equity conference in Chicago, which attracts about 1,000 investors, lenders, people in the healthcare space, thought leaders, and it's a good opportunity to get together with our clients and friends in the industry. That's in May in Chicago. We previously and historically had it in Chicago in February, and the punchline was that it really only attracts serious investors who are willing to come to Chicago in the winter, and it's very much a working conference. It's not a boondoggle where you just show up and hang out by the pool. It's a serious business meeting where people are in meeting mode and they're sharing ideas, and that's the kind of environment we try to foster. We have what I'd call a sister event here in Charlotte, which we've tagged the Healthcare Financing Growth Conference. There's a huge lender community here in Charlotte and across the Southeast, really, but Charlotte's really been a financial hub, and a lot of our major clients are here. So that one tends to be a little bit more healthcare provider focused rather than focused on the PE side, but it's complementary in the sense that it's people coming together and sharing ideas. That's in the fall. I believe we set the date. That'll be announced shortly if it hasn't already, but it's typically here in Charlotte in September.
Bart, thank you so much for joining us today on the Becker Private Equity and Business Podcast. It's always fantastic to visit with you. One of the best professionals I've ever had a chance to work with, the very best. Thank you so much for joining us today.
You bet. Thank you, Scott. Really appreciate it.